So in this video, I'm going to demonstrate how to set up a sterile field for a simple dressing change. Before you start, you want to have checked your doctor's order to make sure that you are doing the dressing change as per the order. You want to use a wipe, a cleansing wipe, to clean off the surface that you're going to set up your sterile field on. And which I've already done, and you want to have performed hand hygiene and identified your patient. You're going to want to bring with you the supplies that you need for your dressing change, which will be indicated in the order. So first you're going to need a sterile dressing tray, and it will show you on the dressing tray, it will give you an expiration date. You want to make sure the package has not been opened, that the expiration date is still within limits, and you can read, there's a list of supplies that are contained within the dressing tray, and so that it'll let you know if you need to bring any other supplies with you for this dressing change. You're going to want to bring some extra gauze if you need it to cleanse the wound, and whatever type of dressing you're going to use to place over top of the wound when you're finished cleansing it. You need your sterile saline, which could be a disposable bottle, a one-time use, or a reusable bottle, tape, and ideally 2 sets of clean gloves, one to remove the old dressing and then discard, and then one to perform your dressing change with. Okay, so the first thing that you're going to do on the dressing tray itself, there's a perforated edge, which I've already removed, but it would be on one end. And then you can remove your dressing tray from the plastic sleeve. Everything that you put in the garbage from this point on, you want to drop from waist height. So you want to have the garbage can between your patient and your sterile field so that you're not crossing over your sterile field to place anything in the garbage can. And everything should be dropped from waist height, as anything we know from the waist and below is not sterile anymore. So the first flap of your dressing tray is going to open away from you, remembering that you have that 1-inch border the whole way around to touch. The next flap is going to open to the right, then the left, and then the final flap will open toward you. When you open up this last flap, there are a pair of sterile forceps in this flap. You want to remove them and keep them facing downward. And this last flap, as you open it, you can sort of square up your tray so that you have adequate room for working. So these forceps now, everything with the exception of my 1-inch border is sterile. So I have to use my forceps to manipulate anything in my sterile field. So you can move your tray a little bit to give you maximum room. Okay, you're going to find a garbage bag, which you can drop onto your table because it does not need to be sterile. And you're going to find a couple of sterile drapes, one which you'll use to drape your patient with, and then the other usually isn't required, but you could use it to increase the sterile field that you have on your table. Okay, when you get to this point, you want to sort of keep your arms as if you had chicken wings. So your forceps are being kept down and your elbows up so that you don't accidentally touch anything on your sterile field. And the reason we keep our forceps down is when you start to use the liquids, water obviously follows the direction of gravity. So dirty water could then run down your forceps where you've touched the handle and drip onto your sterile tray and contaminate it. Okay, so everything in your tray you want to remove, taking care not to place it too close to your 1-inch border. So you have your gauze, you have 2 other sets of forceps, which you can just remove and place like so, and then your other gauze for drying or cleaning, whatever you need. So you can choose to leave some of your gauze in one end and then place your saline in the other. How you set your tray up ultimately doesn't matter as long as you are adhering to the principles of surgical asepsis. Okay, so I can now add things to my tray. So I'm going to set my forceps down so that where my fingers are touching lands on the 1-inch border, and that the tip where that is still sterile is still within my sterile field. Okay, So the next thing I'm going to do is add some gauze to my tray. So the best way to do that is there is a flap at the top that is open. It is the only part that is not sterile. It's sort of like your border for your fingers to touch. The easiest way is to open your package and sort of peel it back like a banana. Once again, your sterile forceps, and remove your gauze and place it wherever you want to place it. This way allows you to have full control over where that gauze lands, and it's not going to land on the floor. So again, I'm going to drop this from waist height. My hands are not sterile, but I still want to keep everything as clean as possible. I don't want to be putting my hands up and down and potentially contaminating my sterile field. Okay, now I'm going to add saline to my tray. I'm going to consider this bottle has already been opened. So you would take a step back from your tray, open the lid. Remember, inside the lid is still sterile, so placing it upside down. I've checked my date and time that this was open, and I'm still within the 24 hours. So I'm going to, because this has already been opened, I'm going to lip the top of my saline so that I can just sort of clean around the top with the sterile saline. Palming my label. And lipping into the garbage can just means you sort of give the bottle a twist like this while a little bit of the saline comes out, like so. Okay, and so now I can take my bottle and I want to pour from the spot, the area that is closest to where I want the liquid to land. So I'm going to place my saline in this pocket right here. It doesn't really matter where you put it. So I'm going to come from this close pathway here. So you want to pour as low as you can so that you don't splatter, but not so low that your bottle ends up touching your tray. Okay, I'm going to take a step back again and take my cover and put it back on my bottle. Okay, now I'm going to set up my garbage bag before I get any further. So you can open your garbage bag away from your tray, and you can have a piece of tape and just tape it to the end of your table, and then it gives you a nice little garbage can, especially for removal of your old dressing. Okay, so at this point I'm going to put on my gloves, again away from your sterile field. You want to keep all of your principles in mind when you set your tray up. If my patient is over here, I'm not going to set my tray up so that I have to turn my back on my tray every time I need to clean a spot. So you want your tray set up in a spot where you can just work like this, so that you're never turning your back to your tray and that your garbage is between your sterile field and your patient. Okay, so at this point is where I would start to cleanse my wound. And you would cleanse your wound according to the module, whether you have a vertical wound or a horizontal wound or a circular type wound will depend on the method that you use for cleansing. So I'm not going to go through each of those. It's well outlined in your module. But the method for all three, for getting your gauze there and drying, is the same with just a different sequence of cleansing and drying. So I'm going to again pick up my forceps, and I'm going to use them to pick up my sterile ones to place in my hand so that I don't contaminate anything on the tray. Okay, and now I can use this one to get a hold of my other forceps. Okay, now the first thing you want to do, I guess I should say that the first thing that you would do is remove the old dressing off of your patient before you pick up your sterile forceps. Okay, so my patient is completely ready to change their dressing now. So you gotta remind yourself, like I just did, to keep your forceps down. You're gonna pick up your first sterile drape. You can't shake it over your tray. Okay, so you're gonna take two corners. Okay, you're gonna bring it over to your patient, and wherever your wound is going to be cleansed, you're just going to let it drop where it wants to drop, okay? And it's just to increase the clean area around where your wound is. Okay, next, I would take a piece of my gauze, and the easiest thing to do, you're going to want to make a little bundle of gauze. So lay your gauze down on where it's still sterile, and you're going to want to fold each corner in to the middle. So fold one corner in, hold it, fold the other corner in and hold it, another one and hold it, and then the last one and hold it. And then you're going to want to grab with your forceps in the very center so that you have a nice little bundle. When I wipe the patient's incision, the ends of the forceps are going to remain sterile because they're tucked into the gauze. Okay? So with your nice little bundle, you're going to dip in the saline, and you're going to use your other set of forceps to squeeze the access out. Okay? And then you would come to your patient and do your cleansing wipe, one wipe down in the direction indicated for the type of wound you have, and drop. Okay? I'll do it one more time. You would take your gauze, make your bundle, bringing all the corners into the center. Like so. Taking a hold from the back so that the ends of my forceps are tucked into the gauze, dipping in your saline and squeezing out the access. Okay? Back to your patient, one swipe in the direction indicated for the wound you're cleansing, drop. Okay? So you're going to do that 3 times, and then when you dry, it's the exact same. You're going to want to bundle your gauze the same way, so that you can keep your forceps clean, like so. One swipe, not dabbing, and drop. And you would continue to do that 2 more times with new gauze each time. Once you've cleansed and dried your wound, then you're going to put your new dressing on. So let's all pretend that this is my, my dressing. So you would simply take your new dressing with your forceps, place it onto the wound, and wherever you first place it, that's where it should stay. So be sure in your placement. You don't want to set it down and then have to drag it into the proper position, okay? You want to make sure that you place it and you're sure in your placement. Once you get that dressing on, there's no longer any need to be sterile, okay? So once the new dressing is placed, you don't need to be sterile anymore, and you would then tape your wound, which we'll go over in lab. Okay? And that is it for this demo video.